Hi, DAR Pediatrics families. It's Dr. D here this morning. So the big question on everyone's mind is school and what to do in the fall. Really loaded question. I'm having trouble myself. Every single parent that I've been speaking with that has school-age children is going through the same uncertainty. Some moms that I've recently spoken with have been doctors, teachers, parents of special needs children, parents with their own elderly parents in the house. We're all in this together. As a doctor mother of 3 girls, I'm facing the same challenges you are. A couple of you have already decided and told your school which way your family was choosing, whether to do all in person or all virtual or some hybrid model. Many schools haven't announced their options yet, so most of you have yet still to decide. And yes, it might seem really daunting, but maybe it doesn't have to be if you look at it through a particular lens. No one answer fits every family. Each of you have a unique set of circumstances that you will consider as you make your decision. But before we talk about making your decision about school, the other topics that keep coming up in the office are about masks and testing. So let's just touch on that briefly. Also, super complicated, no doubt, but let's just review. Parents are asking me if they should test their kids before going to school. At this point, it's hard for me to say, yes, test everyone. Some schools are requiring that all kids above 10 get tested. Some colleges are requiring it. I've seen it on your college forms. I haven't heard yet what our local schools will require. So let's review the tests. There are 2 categories: diagnostic tests and antibody tests. What's a diagnostic test? That's the one that actually diagnoses you. It tells you if you have the infection. Many of you have had it. I know because we've gone through it together. The nasal swab, the PCR test. You can get those results maybe in a day or a week, depending on who does it and what lab you use. And it's pretty accurate if you actually have an active infection at the time of the test. There's another test that's coming out now. It's an antigen test, and that also can give quick results. If it's positive, then that's helpful, kind of like when you have a strep test in the office. But if it's negative, then you might still need to do a PCR test. Again, we don't know how long that's going to take to come back. And the other kind of test that some of you have had, it's the antibody test. That one doesn't actually diagnose you. It basically tells you if your body has encountered the virus at some point and if you have protection against the virus. But it's tricky because, for example, if you had the virus and now have the antibodies, we don't actually know how long the antibodies will protect you. There are no real standards yet. There's no standards even in how long the test takes to come back. I've seen in the same family a child getting her test back in 3 days, but the father's results took almost 2 weeks. So this brings up a lot of questions for doctors and families for the fall and the future. If we do see a resurgence of the virus in the fall, how should we test? What test should we use? A rapid one like the strep test or the nasal swab/saliva test? Will it be covered by insurance or do you have to pay for it? Will there be testing centers, or do you just go to your doctor? I can tell you, even for me, I'm trying to order the tests, and I'm having trouble sorting out what are the best options for my patients at my facility. And if one family member has fever or symptoms, does the whole family get tested? How long should a child stay out of school if he or she has a fever? Does every child with a fever need a COVID-19 test to return to school? So, we're still trying to sort out these answers and are collaborating with doctors and specialists around the country to have a reasonable plan. For now, I think if kids do go back to school, and mind you, it will not be school like we recognize it, if a child has a fever, there will be a protocol about how to clear kids to go back and how to include COVID testing in that protocol. Some schools and communities will be able to offer that testing because they will have the appropriate resources, but other communities may not. And what if there just aren't enough tests to clear everyone? Also, I'm guessing there will be some plan to have teachers tested, likely with some frequency, just like for healthcare providers. If you have a particular concern about getting your child tested, just come in for an appointment or a telehealth visit and we can sort out your specific situation. If you want to read more about testing details, visit our website under darpediatrics.com. You'll find a chart outlining all of what we just talked about. Also today, I read an interesting viewpoint from a superintendent in the South Brunswick School District that I'd like to share, and I will post it on the Dar Pediatrics Facebook page. It's really insightful, stating that there are definitely solutions to in-school learning, solutions to gaps in digital learning, and creating strong school community partnerships. Perhaps, in his viewpoint, it's not the best way to experiment opening large indoor environments with our children and our teachers first. Maybe we need to consider opening larger venues before we open schools. Anyway, lots to consider. Check his statement out. It's on my website, darpediatrics.com, under the Doctor's Corner. The other thing I want to mention is, hands down, masks are non-negotiable. Most of us really understand this, but there are still some non-believers. And yes, things are opening up a bit, but that doesn't mean we can get relaxed about masks. We do miss socializing. We need to be around other humans. We want to go out for outdoor dinner, but we're strong and we can adapt to new ways. If you believe wearing masks is the right way, wearing masks will be very easy. All you need to do is believe. You don't need to be threatened or scolded or scared. You just need to believe it's right for humanity. And remember, it takes practice. On our Facebook page, there are handouts to help your child get accustomed to wearing masks. It won't be perfect at first, but we can do it. I'll give you an imperfect story. And it's not to poke fun, but just to share that change does take practice. We used to tell kids to use a tissue instead of picking their nose, or to sneeze into their elbow instead of out into the open or into their hand. So someone told her kid to take off her mask, sneeze into her elbow, and put her mask back on. I've seen it in the office too. There was a little boy who was about to sneeze, and he went to take off his mask, but I reminded him to keep it on. That's the whole idea. Remind your child that that's what the mask is for, to catch the sneezes, to catch the germs. And of course, constant reminders to wash hands. You guys can do it. Your children can do it. I've seen it here in the office. They've been great. I believe in them. I believe in you. I believe in us. And on that note of belief, if you're given the choice about schools, I also believe that you can make the right decision for your family. There's a lot of talk right now about how to decide. And let me just say, for all of you, you are an amazing parent. You just are. No matter what you decide, you're the best parent. No one is better than you for your child. One of my moms, who has a middle schooler and a high schooler, said, "I just wish I didn't have to decide. I wish they decided for me." Yeah, if we didn't have to decide, we would just deal with whatever the outcome was. We would just deal with it like we dealt with it in the spring. We would figure out how to help homeschooling. We would figure out what to do about babysitting or work or getting food. So guess what? It's really the same thing. Instead of someone making the decision for you, you'll make it. And you'll just deal with whatever the outcome is. You'll figure it out. This part of my talk might be a little less clear-cut, but let's get into it a little and hopefully it'll clear up. So take a look at the worksheet I made. If you don't have it, please go to the Doctor's Corner on my website and print it. If any of you have interest or want help, I'd be happy to do a Zoom workshop with any of you to go over your worksheet and help make your decision. So first, let's identify the facts, just the facts. Easy, right? The fact is that schools are opening in the fall, and you have to tell your school what you choose for your child. consider other facts that are relevant to your family, like the health and ages of others living in your home. Who would watch your children if they didn't go back to school? How many cases are in your city? And remember that it's always appropriate to call your pediatrician or your state health department to ask questions and get facts about COVID-19 in your area. So once you have your facts listed, ask yourself, what do I think about this? What are my thoughts here? Your thoughts can be anything. I'll share some thoughts that some of my parents had. One was, my first grader really needs the social interaction for his brain development. Here's another one. My teenager has to go to school or he'll sleep all day. Here's another one. I just can't help my child with the homeschooling. The math is too hard. Another. If I send my child to school, we may be putting Grandpa Joe at risk. Yesterday, I had a patient's mom, who's a math teacher at a local school, say, this is her thought, I'm so worried that kids will get off schedule. I saw it in the spring. Schedules are really important for them and for learning. So I don't know, you might share her thought. You might have different thoughts. You might read the South Brunswick superintendent's viewpoint and have another thought. So figure out your thoughts and then ask yourself, what feelings do I have about these thoughts? Do you feel nervous, anxious, or do you feel like certain, content, peaceful, confident? So sit with those feelings a little bit. Just feel it out. What do you think? If you feel like you can make a decision, then you're done. That's it. But if you can't, we might need to back up just a little. What's holding you back? What's making you unable to decide? Is it anxiety? Are you worried about what your neighbors might do or say? If you can't decide, we might need to back up a little bit and change our thought, to change our feeling, to help us make that decision. So I'll give you an example. We can change our thought to, yes, my first grader does need social interaction, but since Grandpa Joe, who lives with us, will be at a higher risk, I'm learning to make the best decision for my family. It's okay to be a little sad. We might miss out a little bit, but I'll choose virtual for now and wait for next semester to possibly opt in. And that's fine. Any decision is fine. No matter what, to my families, whatever you decide, that's the right decision for you. You just need to decide and be done with it. So I'll host a Zoom workshop after our schools announce what our options will be. If you want to go through the worksheet together, I'd be happy to do that. We can't predict the future. We can't live with catastrophic what ifs. We just got to go through the facts, figure out what we think about them, feel it out a bit, and decide. And whatever you decide, that's going to be just fine. There's no other way. Until next time, it's Dr. D.